Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Once more, they are saying NEETPG will be in the July ending. Shortly, we are going to have the FMGE exam in a week. So everyone's heart, what is most important? Within the short period of time, where do I get a very high-yield stuff like marijuana? And I can be able to smoke the facts, get ready for the exam. So in this last moments of exam, what is most important for you is all the list of high yield facts. So what is Twitter very famous for? Twitter is very famous for short messaging. So we created a database of 2,000 high-yield facts and short tweets for tomorrow's NEETPG exam, and created a PDF called Anatomy Tweets, 2,000 Anatomy Tweets on the learnograph.com. So let us see how do we revise very fast these high-yield facts as short sentenced tweets. So can the online students can punch as a voice loud and clear for all of you, doctor? Is the font is good for you to follow? Please give your feedback into the chat window. Now, femur ossification. Which bone is ossified at birth? Lower end of the femur is ossified at birth. The limb birds in embryology appear at week 4, one of the favorite questions. So how many limbs? 2 upper limbs, 2 lower limbs, 4 limbs at 4th week. Easy to remember. Where will trachea bifurcate? T5 vertebral level. What is the importance of transpyloric plane? Hypochondrium from lumbar, it separates transpyloric plane. The upper border of the pubic ramus, it forms the arcuate line. What is the anatomical landmark for the femoral artery, doctor? Femoral artery lies midway between anterosuperior spine and the pubic symphysis. How does foramen ovale close in the embryonic life in the heart? Septum primum, septum secundum undergo fusion and foramen ovale closes. The biceps, origin, attachment, nerve supply, very important. Musculocutaneous nerve is the one which supplies the biceps. Biceps, that is in the upper limb. But when you come to the lower limb, you have the vastus medialis, vastus lateralis, vastus intermedius, biceps femoris. So biceps femoris shorthead attaches to medial linea aspera. This attachment is a favorite area for the examiner. Scarpa's fascia, it attaches to the fasciolata of the thigh. Osteoblasts and osteoclasts. What is the function of denosumab? Denosumab is an inhibitor of the osteoclast, which is used as a monoclonal antibody. 60 milligram denosumab subcutaneous injection we give every 6 months to treat the osteoporosis. So osteoblasts give rise to osteocytes, and everything about osteoporosis you need to be sure. Where does gastrocnemius act? Both ankle and also the knee. For their movements, you require gastrocnemius. The pinch grip weakness. It is the anterior interosseous nerve, which is the branch of the median nerve that is responsible for the pinch grip weakness. With a normal thumb movement, whenever it is there, when the pinch grip weakness is there, with a normal thumb movement, you need to think about anterior interosseous nerve as responsible. Gastrulation. What is gastrulation in embryology? It involves the hypoblast cells of the inner cell mass developing is a basis for gastrulation. For the flexors of the wrist and fingers, for the wrist and the fingers, flexors. What is the nerve root? It is the C8 nerve root. C6 is important for your biceps, right? Now, what is torus aorticus? Typically, it is seen as a bulge in the right atrium. It is because of the aortic sinus is what you need to remember. Can the online students can punch? Whether the voice is loud and clear for all of you, doctor? There's a very hot World Cup final going on. But still, I want to see how many will come to the live class, because FMGE exam is very nearby. NEETPG also, within no time it will appear. So we need to keep reading until we get a hold on almost 50,000 tweets. Each of them, I call them tweets because they're short sentenced, easy to revise. Most of the MCQs are framed based upon these single liners. Now you need to know everything about the lesser sac. Greater momentum bounds the lesser sac. Greater sac, lesser sac, boundaries, contents, you need to know. Whenever you do esophageal echo, what chamber of the heart are we looking? The most posterior chamber is left atrium. The most anterior chamber of the heart is right ventricle. Right ventricle. Okay. So the TEE, transthoracic, esophageal echo. What does it test, doctor? The transesophageal echo evaluates the left atrium, is what you need to remember. Any medial epicondyle fracture lead to ulnar nerve injury, and that lead to hypothenar muscles becoming atrophied. From where do somites develop? It is the paraxial mesoderm which gives rise to the somites. Then the boundaries of the epiploid foramen is the favorite question of the examiner. Bile duct is anterior to epiploid foramen. The foramen of Winslow is what you need to remember. Whenever there is any ulnar nerve injury, which fingers and which movement is affected? The little finger, ring finger, there is a loss of extension. So interphalangeal extension, metacarpophalangeal flexion is the function of lumbrical. So the medial lumbricals are supplied by ulnar nerve. Ulnar nerve injury leads to loss of extension of the little and ring finger, which is responsible for the clawing, is what you need to basically remember. Very good to see 8 online classmates in spite of the World Cup. So let us see who is popular, Virat Kohli or Murali Bharadwaj class. Now, tibialis posterior, how does it originate? Tibia and fibula and interosseous membrane between the two bones gives origin to tibialis posterior muscle. Ulnar nerve injury. Ulnar nerve injury typically affects the little and ring fingers. From where does peritoneal cavity develop? Peritoneal cavity develops from intraembryonic coelom. So once more, a bit of embryology. You need to know main points. You can't master the embryology. So the lesser sac, relationship of the stomach, everything you should know. Lesser sac is bounded by posterior wall of the stomach. You have anterior wall, posterior wall of the stomach. Posterior wall of the stomach, typically the lesser sac is bound. It is a boundary of the lesser sac is what you should remember. SA node is that specialized conductive tissue which gives rise to the pacemaker potential in the myocardium. Whenever radial nerve injury, there is a wrist drop, sensory loss on the dorsum, back of the hand is what you should remember. So there is a paracolic gutter. Whenever spleen enlarges, it projects into the paracolic gutter. Pericardial cavity is formed from intraembryonic coelom. So you should know peritoneal cavity, pericardial cavity, they all come from intraembryonic coelom. Posterior interosseous nerve is a branch of the radial nerve, and whenever that is injured, there is a difficulty to extend the fingers. But posterior interosseous nerve is a purely motor nerve, no sensory supply. So there will be no sensory loss, but difficulty to extend the fingers is the problem whenever posterior interosseous nerve, which is injured. Now, whenever pyloric ulcer, it perforates, where will it perforate its collections go into? They go into the right subphrenic space. Below the diaphragm, you have the right subphrenic space. So all the spaces, Morrison's pouch, everything you should know for the tomorrow's exam. So whenever the somites are forming, you have cervical, thoracic, then lumbar, sacral. Somites initially form at the level of the cervical level, is what you need to remember. So where is aortic valve, doctor? Aortic valve, typically the surface marking is in the left third intercostal space is what you should remember. Parafollicular cells are one of the neural crest cell derivatives. In the thyroid, parafollicular cells are derived from neural crest. So which is that muscle? Whenever it is weakened, it leads to Trendelenburg's test, pelvic tilting in walking, waddling gait. It is a gluteus medius is what you need to remember. So where is mitral valve? Mitral valve surface marking is behind the sternal end of the left fourth costal cartilage is the mitral valve. It is the ascending aorta, which forms the right heart border on the PA view on chest X-ray. It is the recto-uterine pouch between the rectum and uterus, the Douglas pouch. The recto-uterine pouch is most dependent in the standing position. Sympathetic ganglion also is a neural crest derivative. Trendelenburg's test, gluteus medius, superior gluteal nerve, you should not basically forget. From where are the glomus cells derived, doctor? They are derived from new rectoder. What is LAD? Left anterior descending artery, coronary artery called as. It is called as a widow's artery. Any occlusion of that will lead to infarction of the anterior left ventricle. Fossa ovalis. Fossa ovalis is a remnant of the septum primum embryologically. So you should know the embryology of the heart, one of the favorite areas of the examiner. So how many primary ossification centers are there for femur? Lower end of the femur is ossified from one ossification center, typically which will appear when the baby is born. Membrana tectoria. It is derived from posterior longitudinal ligament. All that pelvic pain is mediated not by the splanchnic nerves but by autonomic nerves. Pisiform is an example of a sesamoid bone. All sesamoid bones we should know. So from where is the suspensory ligament of the penis formed? It is the scarpa's fascia. From where the suspensory ligament of the penis is formed is what you need to remember. Latissimus dorsi, serratus anterior. What is their nerve supply? You should be very sure. Latissimus dorsi inserts into the floor of the intertubercular sulcus. Intertubercular sulcus. Latissimus dorsi insertion is very important. Whenever a person is falling from a tree, when there is a hyperabduction of his arm, then that will cause lower brachial plexus palsy, which is called clunky paralysis. Whenever right superior gluteal nerve damage is there, it will cause the left hip to drop during the Trendelenburg test. Very favorite question of the examiner. The tunica media of ascending aorta, it is also a neural crest derivative, is what you need to remember. Supinator jet. What is the root value of supinator jet? C5, C6 is the root value of supinator jet. Like this, like a rapid force, you should do the revision before the exam, doctor. So there are 2000 tweets which you should know when you go for the NEETPG exam. Now, omental bursa, where is it located? It is the left subhepatic space को कहते हैं omental bursa. So we call right coronary, left coronary dominance. What will decide whether you are a right dominant or a left dominant coronary supply? Everything depends on from where is the posterior interventricular artery. Between the two ventricles, posterior interventricular artery is there, no? Whether it is originating from right coronary or left coronary will decide the coronary dominance. What is the largest branch of the brachial plexus? It is the radial nerve. So you should know everything about ectodermal, endodermal, mesodermal derivatives. Gallbladder is derived from endoderm, is what you should remember. Very good to see 6 online classmates in spite of the World Cup. Now, Orbach's plexus, it is also neural crest derivative. So 2000 tweets. Tweets are the short sentenced single liners based on which examiner frames the MCQs. So when we retrospectively analyze the INA, CET, FMGE, NEETPG and all this, we should know what are those statements, the database of statements, the knowledge base that you should be good with to answer the question successfully. So if you take anatomy, there are about hardly 80 to 90 high yield topics. On each topic, you should know around 15-20 important points. So around 2000 points, if you know, you are clear through the anatomy. 6 to 7 questions come in the NEETPG, which you can solve. So the purpose of the tweets is basically to give you a quick run through those 2000 database of short sentence single liner tweets, which will make you the winner. Axillary nerve. It is the axillary nerve which accompanies the posterior circumflex humeral artery. As I told you, the lesser sac is bounded by posterior wall of the stomach. Now, posterior interventricular artery can arise from the right or left coronaries. But circumflex artery can also give rise to posterior interventricular artery in about 10% of people. Any pyloric ulcer perforation affects the omental bursa, is what you need to remember. So when do you call left dominance? When circumflex artery, when the posterior interventricular artery, instead of arising from the right coronary, if it arises from circumflex branch of the left coronary, then you call it as left dominance, is what you need to basically remember. Melanoblasts are also the neural crest cell derivatives. Whenever you are moving from a sitting to a standing position, what is that main extensor that maintains your posture? It is the gluteus maximus. Now, how is interventricular septum supplied? The ventral 2/3 of the interventricular septum is supplied by left coronary artery, is what you need to remember. Corneal stroma is a ectodermal derivative. What is the muscle which has a intracapsular origin inside the capsule? Popliteus muscle typically has intracapsular origin. If you look at the right coronary, left coronary, right coronary artery diameter is less than the left coronary artery. Now, what is the function of popliteus? Whenever the foot is off the ground, the tibia need to undergo medial rotation, without which there is a locking of the knee joint which will occur. And this tibial medial rotation is caused by the popliteus, is what you need to remember. Ameloblasts in the teeth are ectodermal derivatives. The acute marginal branch is a branch of the right coronary artery. Just like left anterior descending artery, circumflex artery, they're all the left coronary artery branches. Brachioradialis is the one which flexes the elbow. Brachioradialis is supplied by the radial nerve, not the median, not the axillary, not the musculocutaneous. Where is pouch of Douglas? It is a recto-uterine pouch. It is between uterus and rectum, is what you need to remember. Superficial external pudendal artery, which is very important for supplying the genitalia. It is a branch of the femoral artery. The Koch's triangle arterial supply comes from which coronary? Right coronary, not left coronary. Which is called Erb's point. The junction of C5, C6 is called Erb's point. Erb's palsy is the upper brachial plexus palsy, is what you should remember. So, superficial epigastric artery, it is a branch of the femoral artery. Sphincter pupillae, dilator pupillae, generally muscles are the derivatives of mesoderm. But sphincter and dilator pupillae are not mesodermal, but they are neuroectodermal derivatives, is what you need to remember. From where does femoral head gets the blood supply? Lateral epiphyseal artery is the one which supplies. Ulnar collateral nerve. Ulnar collateral nerve, it is a branch of the radial nerve which supplies the medial head of the triceps, is what you need to remember. Now, neck of the femur to the shaft. What is the angle, doctor? It is 125 degrees. Who prevents the urine extravasation in ischiorectal fossa? It is the Colles fascia. So you should know extraperitoneal, intraperitoneal, rupture of the bladder. How do they differ? What are the differences? 4 to 5 differences are there. Every study material talks about it. So Colles fascia, it is the one which prevents the urinary extravasation in ischiorectal fossa. In the atlas, there is a transverse ligament. It is a part of the cruciform ligament. Of all the various systems in our body, it is the circulatory system, beating of the heart. They are the functions which start first in the fetus. Lower lateral cutaneous nerve of the arm. It is the branch of the radial nerve. Blood supply of the femoral head comes from obturator artery. In the radius bone, what is the nutrient artery? It is the anterior interosseous artery, which is the nutrient artery of the radius. Now, the venous drainage of the heart, you should know. Some of the venous drainage, instead of draining into the vena cava, directly drains into right atrium, coronary sinus, hence directly into right atrium, which is called the laborer's nerve, doctor, median nerve, musician's nerve, ulnar nerve. You need to be very sure. Paraduodenal fossa. What are the boundaries? It is the inferior mesenteric vein, which is a boundary of the paraduodenal fossa. Buccopharyngeal membrane. There is both endoderm and also ectoderm in the buccopharyngeal membrane. If you want to test the radial nerve, median nerve, ulnar nerve, all the three nerves, then you need to test the movements of the thumb, opposition of the thumb, flexion of the thumb, extension of the thumb, adduction and abduction of the thumb, everything. Then you will know median, ulnar, radial, all the three are involved in the thumb movements. In the knee joint, you have genicular arteries. In that, the middle genicular artery is the branch of the popliteal artery. Where is the great cardiac vein, doctor? In the anterior interventricular groove, where the left anterior descending artery is passing. Great cardiac vein also will be passing side by side, is what you need to remember. Intersigmoid sinus recess. It is present in infants, but as the infants age, the intersigmoid recess will disappear. Then, which vein in the heart accompanies interventricular artery? Posterior interventricular artery. Anterior interventricular groove में great cardiac vein. Posterior interventricular artery को accompany करने वाला होता है middle cardiac vein, is what you should remember. Can you palpate popliteal artery? No, because it is very deeply located. In the intersigmoid recess, which is present only in infants but disappears with age, left ureter typically lies in intersigmoid recess. So, transverse mesocolon, what is the artery present in it? It is the middle colic artery, which is there in the transverse mesocolon. All the skeletal muscles, they develop from paraxial mesoderm. Paraxial mesoderm. So, you know, SITS group of muscles of the rotator cuff. S for supraspinatus, infraspinatus, teres minor, right? SITS and subscapularis. In this, subscapularis is called forgotten rotator cuff muscle. Now, which vein in the saphenous veins continues from medial part of the deep venous arch? It is a long saphenous vein, continues from the medial deep venous arch. From where extra embryonic mesoderm will derive, doctor? From the primary yolk sac, extra embryonic mesoderm is derived. Great saphenous vein, will it run anterior or posterior to medial malleolus? It runs anterior to medial malleolus. Denon-Willet's fascia, where is it located? It is between rectum, prostate, and the seminal vesicles. the non-villus fascia. From where does sympathetic innervation of the heart comes from? It comes from T1 to T5 is what you need to remember. Now, we suffer angina pectoris. Who carries that sensation of the chest pain in angina pectoris? It is the middle and inferior cervical cardiac nerves which carry the sensation of angina pectoris. Nerve of Grassi, it is a branch of the right vagus nerve. So what is the importance of nerve of Grassi? Why it is called nerve of Grassi? You need to get that enthusiasm. But remember, for entrance exam, you need to know right vagus nerve gives rise to nerve of Grassi. When will trophoblast differentiate into cytotrophoblast and syncytiotrophoblast, doctor? By day 6, the trophoblast differentiates into cyto and syncytiotrophoblast. Now, in the varicose veins, you should know the various perforators. What is the name given to the mid-thigh perforators? Hunterian perforator is typically seen mid-thigh. The pain of the angina passes down the left arm by a thoracic splanchnic nerve is what you should remember. What is that branch of the vagus that supplies the stomach, doctor? Nerve of letter jet of the vagus. So you should know what is meant by selective vagotomy. Where do we spare the nerve of letter jet? So nerve of letter jet of the vagus is seen in stomach. Rhomboidus major, it is a dorsal scapular nerve which is the nerve supplied. Trophoblast becomes cyto and syncytio by day 6. And maxillary bone is an example of a pneumatic bone. Pelvic viscera, preganglionic parasympathetic fibers come from S2, S3, S4. Always remember, craniosacral outflow is the name given for parasympathetic supply. Thoracolumbar is called sympathetic supply. So craniosacral, why parasympathetic is called craniosacral flow? Cranium, vagus nerve, oculomotor nerve. These are the various cranius nerves which carry parasympathetic output. Similarly, in the sacral area, S2 to S4 ventral rami, which supply the pelvic viscera, they carry the preganglionic parasympathetic fibers. Extensor carpi radialis longus, where does it lie, doctor? It lies lateral to the distal radial tubercle. And what is the cause of the transposition of the great arteries? It is the non-spiraling. Normally between aorta and pulmonary trunk, there is a septum. If it doesn't spiral, then the aorta and pulmonary will attach to wrong chambers of the heart. Aorta, instead of arising from left ventricle, will arise from right ventricle. So transposition of the great vessels is due to the non-spiraling of the aorticopulmonary septum is what you need to remember. Where is cardiac ganglion? It is below the arch of aorta. From where is the venous flow whenever there is any valvular incompetence? Instead of going from superficial to deep, it will go deep to superficial, which lead to varicose veins is what you need to remember. Whenever you are climbing, it is the latissimus dorsi, which is called the climber's muscle. When will primitive streak will form in the embryology? It begins at 3rd week. Normally, as I told you, muscles come from mesoderm, but dilator pupillae is derived from the neural plate ectoderm, is what you need to remember. Inferior epigastric vein drains into external iliac vein. The most important blood supply of the stomach is from left gastric artery. Saphenous opening is covered by cribriform fascia. What are Purkinje fibers, which are the part of the conduction system? They are modified cardiac muscle. The short head of the biceps brachiae attaches to coracoid process, biceps brachiae. The great toe of skin and the fascia, the great toe means medial side of the foot. It goes to superficial inguinal lymph nodes. Where do you find Brunner's glands? Brunner's glands histologically are the hallmark of the duodenum, is what you need to remember. Long head of the biceps brachii is intercapsular but extra synovial. How long is the human intestine? 15 meters. Where is trachea? Which part of the mediastinum it is? You have anterior, middle, posterior, superior. Superior mediastinum mein hota hai trachea. In the femoral triangle between vein, artery, nerve, lymphatics, what is most medial? Lymphatics are most medial in the femoral triangle. Dorsal aorta muscularis arise from muscular layer, arise from paraxial mesoderm. Adrenal cortex develops from intermediate mesoderm. So you should know different forms of mesoderm, what arise from each of them. You need to be very, very sure about. Very nice to see Ravinder, late but latest available. So Ravinder is asking, is this 2000 anatomy tweets? So totally, I'm going to launch 20 ebook PDFs, each containing short formatted single liners for a rapid revision called tweets. Each subject may 2000 to 3000 tweets. Big subjects like medicine, surgery, gynocs will have 5000 tweets that you need to master, right? So all the MCQs arise from these tweets. So by tomorrow, I will upload the anatomy tweets PDF on the Learnograph as an ebook. So take opportunity to download that. So you can see within no time, we finished around 150 tweets within 35 minutes. Very short period of time. So every hour you can finish 300 tweets. Imagine if you finish 300 tweets, in 6 to 7 hours, you can finish 2000 tweets in anatomy. That's how last moment revision should be. Tweet, tweet, tweet with Dr. Murali Bharadwaj. Thank you once more. I also love to go back and watch the World Cup. And very interesting match, defensible score. I hope India should win. Anyway, keep going for your NEETPG. Don't stop your preparation, doctor, because if you stop, the river Ganges should not stop until it meets the ocean. That should be your preparation. Good night. And once more, we will all meet up tomorrow, every day.